Good morning, Peter Goertz. I'm a psychiatrist. Cough syrup abuse. We can all be blindsided. That is not something I knew a lot about. And I saw a patient who had a marked change in behavior, and he'd also been confused, still was confused actually when I saw him, and he'd shown some possible paranoid thinking. His CPK, when they checked him in the hospital on his blood work, was markedly elevated, so that's a sign of muscle injury. When I talked with the patient, he was still confused. He did not know where he was, in what city he was, so he was not in his usual state of mind, but he was able to give some information. And he said he'd been using cough syrup mixed with soda, and he had not been the one who mixed it. So apparently this is sold by people already mixed cough syrup with soda. And the soda apparently is added to counteract the bitter taste. So excessive doses of cough syrup and the effects from that. What's in cough syrup? So certain ingredients are commonly in cough syrups. So one ingredient is dextromethorphan, another is promethazine, and you can, for instance, have combinations. So there's a combination preparation of dextromethorphan with promethazine together. And you can also have other things in cough syrup like codeine, guaifenesin. Dextromethorphan is a non-opioid derivative of morphine. It's an NMDA receptor antagonist. It can cause, in high doses, can cause psychosis, can also cause rhabdomyolysis, which is muscle breakdown. So that could, for instance, in our patient, explain the high CPK, the high muscle enzyme on the blood work. Promethazine is a phenothiazine, and interestingly, apparently it's been seen to cause psychosis, which you would not think, because phenothiazines, some phenothiazines were used as antipsychotics, still are to an extent. Some of the first generation antipsychotic medications are phenothiazines, so they can be used to treat psychosis. But again, apparently promethazine can be given, or it can cause psychosis. And promethazine also is anticholinergic, and in excessive doses can cause confusion, which is not unusual for an anticholinergic medication to cause confusion. It can also, since it is a phenothiazine, it's understandable, it can also cause neuroleptic malignant syndrome, which is a constellation of signs and symptoms, one of which is rigidity. And marked rigidity can cause muscle breakdown. And we had the high CPK again, which is a sign of muscle breakdown in this patient. Codeine is an opioid. Apparently it can also cause psychosis. And guaifenesin even has been apparently shown to cause mental state changes. Now, another thing, of course, to think of in a patient like the one I'm describing, and especially in nowadays, in the current world, a lot of things can happen. So when someone seems paranoid, you always want to consider that potentially there is someone after the person. So in this particular patient, that's one thing I was wondering about. Is he actually paranoid, or was he paranoid, or was someone actually trying to harm him, or was there even a combination of both? So that's another aspect to think about. Thank you.